You know that your rulers, like the good Boris Johnson, are not based on science. They're based on populist politics. When you come to China, it's a different form of politics, but it's all about politics all the same. I'll put it, if I can, in a nutshell, Steve. Number one is the fact that there are rather a lot of people in China, 1.4 billion. Of those people, probably 1 billion have not had 2 shots, and all Chinese vaccines need 2 shots. And furthermore, the efficacy of Chinese vaccines is slightly below 60%, unlike, say, Pfizer COVID at 98, at least within the first months. So you can see by the arithmetic that approximately between 500 and 1 billion people in China are at risk from a highly contagious form of COVID, Delta. So the reason why China has a zero tolerance policy is because it is far too risky to have anything else.
But David, you say that the Western approach, the Boris Johnson government approach, is not based on science. And it's not for me to defend A, science, and B, the government's approach to its version of the science. But actually, we do have better efficacy, as you just alluded to. It appears anyway, on some of the drugs that are being used to inoculate the British and the Western population as well. There isn't yet the same efficacy issue. There is a majority of the population which has had 2 shots as well. And there is a large strain of science that says actually a degree of herd immunity is being reached, has been reached, or will be reached very soon as well. Surely the Western approach, given its background, is actually just as valid as the Chinese response.
Oh, I'm not saying that the Chinese are awfully clever and that the Westerns are very stupid. I'm not saying that. What I'm saying is that given the amount of the population that has been vaccinated twice, which has to be the case in China. There's no one-shot vaccine. And given the efficacy rate of the vaccines being approximately 60% instead of 98 or whatever percent, you have no choice in China but not to take the risk, that something like Delta can spread like wildfire. That's what I'm saying. I think the approach is rational, but the reasons are different, and they equally justify what is going on. Having said that, you and I know, Steve, and you're usually less modest, that we know just as much as the politicians. And frankly, the big test is going to come in the winter when we see if the number of people who fall seriously ill from Delta or whatever the successor strain is overwhelms health systems or not.